also. Dr. Dobbs, good morning, sir, and happy holidays to you. Everything going okay?
Yeah, good morning. Yeah, no, it's good to see you today. Thanks for having me.
There are, first of all, I'm going to get this out of the way because Russ and I were talking about it. Your thoughts as far as the trial itself or the hearings yesterday with your name attached to it. How have, over the dinner table, how have you guys been handling this?
Boy, I think one of the things that's really good for folks to understand is that my name's on it as the plaintiff simply because I'm the head of the health department, right? And so a
Right.
lot of folks don't realize that. So that's important to know. I've tried to kind of lay low. I understand that, if I speak out, it would be detrimental not only to my role, but also to the case. So, we're just trying to be circumspect. Of course, I listened to it yesterday, and obviously we'll wait to see what's going on. But, all the credit and the work really is going to be the AG's office and the governor and the legislature.
And I think people need to know that, regardless of who's in there, the name is going to be attached to it, like Roe versus Wade. Let's get to, first of all, this new variant, Omicron. What is it, Omicron or Omicron?
Oh,
What is it? I've heard it pronounced a couple of different ways. I think it's Omicron. Is it Omicron? Tell me about it. What do we know? What do you know so far as the Mississippi State Department of Health?
Well, first off, we have not identified any cases in Mississippi. We have some in the United States, as you know, but clearly there's more of it in the United States than we know. There's a week or two delay in our surveillance efforts from when we collect a sample and we know its full genetic sequence. So that does take a little bit of time. But what we know from our observation of what's going on in Africa, and then Israel has some preliminary information, it does seem that it's going to be pretty contagious, probably the same order of magnitude as Delta. We're gladly not seeing an increase in deaths and hospitalizations as we might expect for a more virulent virus, more deadly virus. So if you look at South Africa's case curve, the increase in cases is not proportional to the deaths and hospitalizations. So there's some hope that it might be a milder when it comes to clinical, but it's too early to know. Mm-hmm. There is some really good information and reassuring information out of Israel, where the Ministry of Health has released data. Well, they've released the information, but I haven't seen the raw data. That it looks like the Pfizer vaccine still largely retaining efficacy against Omicron, and that the booster may be super useful. So we really want to make sure our vulnerable folks get a booster going into the holiday season.
I guess you almost exponentially get more data every single day, and it's one of those things that we just don't know what we don't know, and it's going to take more data coming in to make some logical decisions on it, whether they're political decisions or from the governors of each state and so on and so forth. But this strain of the variant of the virus has been matriculating through the African nation for a while, or all through the continent for a while. It's not something that just showed up. It's been there for a while, has it not?
Typically it's been there for a while before we see it. There was a little bit of a surprise with this variant in that it had a substantial number of mutations, right? It wasn't really related to strains that we've seen circulating. It's not really a variant off of Delta. It didn't branch off of Delta. It kind of came off sort of like a little known under-followed variant. So it's a little bit strange, but yes, it has been circulating, and it does speak to just how interconnected our world is, that we can find something in Africa that was detected a couple of weeks ago, really, and then almost immediately there's cases across the world.
Well, and as far as being contagious, we have no idea if it's the same contagious abilities as you mentioned earlier, Delta. From what we hear from the good doctor who actually accidentally released this, and she had no idea that the information was going to take the import that it has, but she says the symptoms were very, very mild. From what we heard, the symptoms were very mild, slight fever, maybe some body aches for a couple of days, and that was basically it.
Yeah, and certainly anecdotally, we're hearing that the folks are getting over it relatively easily. The other thing that's been kind of strange is that they're not really reporting the same sort of loss of taste, loss of smell sort of symptom. Right. So it may vary a little bit. The gentleman from California who was diagnosed with it, he was vaccinated and really had minimal symptoms, what we understand. So, just want to reiterate, the point of the vaccine is not just to keep you from ever having the virus, it's to keep you healthy and not to die. So That's what we always think. It's the same as flu. I think when you think about this, like with flu, and it's been almost a year for a lot of our older folks who've had the vaccine. So just think almost like it's time for your annual shot. So if you hadn't had your COVID shot this year, because you need a booster, get your booster going into the holidays.
Are all three boosters still available? Johnson and Johnson, is all three still there? And do you still have to take the same one if you had a Pfizer, get a Pfizer booster?
They all are available. There is some flexibility now where, if you want to get a different one, you can. It's hard to know, if you should get one or the other. I mean, in general, folks just get the same one they had before. But practically speaking, if you show up somewhere and they only have Moderna and you took Pfizer, go ahead and get the Moderna while you're there. The practicality of it seems like that's the main driver. Now we have some evidence that Pfizer might be good against the Omicron variant. We would maybe presume that Moderna would, but we don't know. So again, more information forthcoming.
The way that I always looked at it on a personal basis is like getting a shot of vitamins. I mean, you're going to build up your immunity toward this virus in whatever form it happens to be, better than if you did not. And if you happen to get it, and the body defenses are down a little bit, then it will help you recover from it, much as if you've got a vitamin shot. But to each his own, and some people will do it, some people will not do it. How do we look in the state of Mississippi? We had yesterday 468 cases. We had 2 additional deaths. I'm not sure if you posted the new one yet.
No, I don't believe we posted the new numbers yet, and I haven't seen them this morning.
Mm-hmm.
We are on an upswing. It's just we're just not sure what it's going to look like. Our hospitalizations are up significantly. We have seen increasing nursing home outbreaks. We have seen more cases, but the case reports are going to be a little bit different. We're not going to depend on those so much because a lot more folks are diagnosing themselves at home. And we're not seeing those. So we'll have to be wary that the case numbers may not reflect reality because of the practicality of people being able to test themselves at home. But, be careful. Our healthcare system, our hospitals are absolutely overwhelmed with, low volumes of patients right now. We've had such staffing issues. We're already having trouble transferring people who need to go to higher levels of care. And as we add on flu and COVID cases, it's going to be a bad winter, I'm afraid. So the other part of that is get your flu shot too. And please, for heaven's sake, if you feel bad, don't go to the holiday party, right? Let's spread holiday cheer.
True.
Let's not spread COVID and flu.
Is the same directives out there to, if you want to, get it at different times, or you can take both of them at the same time, your flu shot and your booster shot?
Yeah, you can take them at the same time. It's perfectly okay. So, if you hadn't had both of them yet, go ahead and get them both.
I do want to ask you this. You said there was an increase in hospitalizations. Do you have the numbers, Dr. Dobbs, as far as the increase in hospitalization? What percentage of those have already been vaccinated?
Yeah, we do. It's about 90% of the cases are unvaccinated, the hospitalizations. So, it's just like it has been. It's varying between like 87 and 90%. Yeah. Now keep in mind that 10% vaccinated is a little bit misleading because those are our older folks who are vulnerable. And so, and we know that especially younger folks, 40s and 50s, if you get the vaccine, your risk of death is really almost zero. But our older folks, right, we definitely need to make sure they get the booster. And also for younger folks, it's a good idea.
Well, 90% of the people who are admitted to the hospital have not been vaccinated, and that's pretty good number to rely on. I do want to ask you for an update on how the younger generation, how are we doing as far as vaccinations with those that now are permitted to get the vaccine at a younger age?
We're making progress. We have about 11,000 kids and, millions of doses for kids across the country. So that's going to help us out going into the holidays.
Look, I thank you for spending the time. I think we've covered everything. Anything else you want to mention while we got a few seconds here?
Just be safe going into the holidays. Make a COVID plan. Maybe have some tests at home that you can do over the holidays, and make sure you know where to get monoclonal antibodies. You don't want to be, struggling when you're sick. You want to have a plan made ahead of time. So please be safe over the holidays. Good, very good point. Dr. Dobbs, thank you, sir. Appreciate it very much. The State Health Officer, we thank you and happy holidays to you and your family. Yeah,
we got more coming up